They'll never leave here, not unless they're carried out hogtied. This is their home. This is where they want to be. This is where they want to die.
I moved here 1946. My gosh, raised all 5 kids here.
I don't want to leave my home. Neither one of us want to leave our home.
After he had open heart surgery, he was in a home for about 3 months, but we just thought he needed to be home.
Hello, I'm Ellen Hughes. Pennsylvania's senior population is growing. Soon, 1 out of 5 people will be over the age of 65. Most of us will face the challenge of caring for an aging parent or spouse. Over the next few minutes, you will meet 3 families, all helping their loved ones stay at home. You'll learn about the challenges and the rewards for the entire family when an aging loved one is able to be cared for at home. Their experiences can help you answer questions you may be struggling with, like, how do I know what's the right care or enough care? Who can help? Can I afford it? And most importantly, what is the best care? To find the answers, let's first visit George and Gloria Hart.
Amy.
George and Gloria have lived in the same home for over 43 years and raised 5 children here. George, a Purple Heart recipient, is in good health after surviving 2 bouts with cancer. But his wife, Gloria, lives with heart disease, controlled by several different medications.
There was so much confusion sometimes about all the different doctors she had seen and what medications she should be taking and what schedule she should follow up on. And oftentimes she was confused about the orders and the changes that were made by the doctors in the hospital. So I said something really needs to be done. Somebody has to come in and basically manage her care. And that's what Leslie has done.
Once at dinner time, so that's good. Good job.
My main focus at that point was education, making sure she was knowledgeable about her medications. I go to doctor appointments with her. I hear things that sometimes they may not hear. I follow through things with instructions that they give her to do. I also speak for her sometimes to try to get the point across, because sometimes physicians are very busy and they want to give a lot of information to people so quickly that people walk out and kind of look at each other and say, what was just said?
It feels very good to make sure that I can give back to them what they have given to me in the past as well. I had a great home life, and so I want to keep them in the home where they feel most comfortable and where they have great memories.
Home care agencies like the one Leslie works for recently became licensed under the Department of Health.
There's a uniform set of standards that everyone has to follow at this point in time. And I think that when you educate yourself on what those standards are, especially in regards to hiring of these attendants, it can give you some peace of mind.
All home care agencies that provide personal care are required by law to ensure the following. First, that they conduct a criminal background check on all workers. Second, that workers are proven competent in at least 10 areas like safety and infection control. And last, that workers are free of communicable diseases like tuberculosis. While George and Gloria needed personal care assistance, our next family needed more medical care, and in their case, in-home hospice was the answer.
If there's anybody that needs help, the Michelone family is known throughout this whole town. I don't care where you go. They've eaten at this table.
Now it's Ronnie Michelone who needs help. He's had surgery and exhaustive treatment for a variety of illnesses. Now hospice, along with family and friends, is providing care so Ronnie can spend his last days at home.
After he had open heart surgery, he was in a home for about 3 months. We just thought he needed to be home.
I wanted to be home.
And you made that clear to everybody from the start.
People, when they get sick, you know, they're kind of isolated at times because family have other things to do and everything. But here the family makes this number one. They actually have a schedule where they each come in and they spend the night and they spend the days, and then they have a caregiver when they can get a caregiver to come in.
It's not as though home care is there to provide total relief for the family, but certainly we do whatever we can And even the treatment plans that we collaboratively create with the patient and their family don't just treat the patient, they treat the entire unit.
Anytime I had a question or a concern, being that hospice nurses came in every day or every other day, we were able to talk to them.
Hospice care is not about dying. It's about living one's last days to the fullest extent. Medicare pays for hospice care for seniors, but requires a terminal diagnosis certified by a doctor with a 6-month survival rate. It also pays for brief and intermittent in-home medical care. Hospice also provides spiritual support, not only to the patient, but also to family and friends.
It is a privilege that we are allowed to come into people's homes. It's an honor that we can be a part of their lives during this time. So it is very satisfying for hospice workers to be able to do what they love to do.
Jake and Pat Barrick were married in 1952. After working and raising 4 children, they bought property on a Lock Haven mountaintop and literally built their dream home together. Your house is beautiful.
Oh, thank you.
I love it.
Thank you.
And I was told that you two built your house yourselves.
Yeah, we did. I picked that up and built all that. Her and I built that together. Yeah.
The two of you?
Yeah.
And made it your own?
Yeah. She was in there helping. She was helping.
With the hammer?
Right, yeah. Yeah.
But in 2008, Jake had a stroke that made it difficult for him to talk. 2 years later, Pat was diagnosed with Alzheimer's. The Barrick's children live several hours away. I sat down with them to talk about the challenge of helping their parents stay in the home they love.
Dad had a really bad week with Mom, and he just, he would say, "I wish it was like it used to be." He was just overwhelmed. You just could tell that he was, he could hardly put, yeah, he did.
He looked defeated.
It's a friend of mine, Denise. She had just told me there's options. I just didn't realize that there was so much flexibility with hours that could be made, the 24/7 that could be done, which ends up being cheaper than,
than a nursing facility.
Social-wise, it's having somebody here that she can, spend time with, and she's really grown very fond of Marie because she doesn't really go that many places.
She doesn't get it with Dad quite as much either because she has a hard time understanding him.
They have a hard time understanding each other.
Are you stormy?
It gives us peace of mind knowing that somebody's here every day now. That if something happens, we know right away. She lives close enough that if Dad would have an emergency, if Mom would have an emergency, they can call her or the other caregiver.
As I look back and recall the conversations with these 3 families, I'm struck by their unwavering commitment and their strong determination to do whatever it takes to help their parents stay at home. It's not always easy, but there is help.
I think the first place to look at when you're considering home care is to contact your local agency on aging. Because if you are over the age of 60, that's going to be your first resource as far as determining what kind of programs you may qualify for.
As you consider home care for yourself or a loved one, there are some important questions you should ask providers. First, what kind of training is required for workers? Second, what will it cost and what are my options for payment? And third, what happens if I need to change my hours or if the caregiver doesn't show up? You can also ask for a safety assessment.
Generally speaking, it's always a good idea to have a home safety assessment done so that you know that if you are going to keep your loved one in the home, you need to make sure that if they need safety bars, if they need bathroom modifications, anything along those lines, have the safety assessment done, figure out what needs from the home safety standpoint, number 1. Number 2, you should be looking at assistive technology needs. And by assistive technology, I mean maybe low vision aids, hearing aids, special adaptive equipment to enable them perhaps to even still use their computer for socialization.
The Pennsylvania Home Care Association can be a resource for families. Visit pahomecare.org or call 1-800-382-1211 for additional questions to ask and a directory of home care providers near you. Finding the right kind of home care can seem like a daunting task. Help is available every step of the way, but you must take the first step. Begin planning before there's a crisis. Ask your loved ones what they want and ask yourself, what do you want when you can't do everything that you once could? Talk to your family. It is one of the most important conversations you will ever have.